meet in person, but most of the time they're virtual, but we treat it in the same way. So Arlene and Christina and Heather Baker's in the house. And John Bitterman, our amazing, amazing board member, and MT from our team, and all these other amazing people. Good morning, Vero. They're all listening to us now. So they're hearing me babble and they're hearing us laugh. And then nobody will hear it on the recording because a lot of people will hear this later, right? So it starts, I will, in about 1 minute, about 60 seconds, give it a breath because then we'll start, the recording will be cut from exactly 9 until we finish at 10 or 10:01 at the latest. Okay, make sense? Everybody good? Everybody good? All right. Yay. Amy. And just like Amy's doing, we encourage our panelists and our presenters to also talk in the chat. You can share any information that you want, lead people to things, say, you can give a shout out to somebody you see there, whatever you want. This is very communicative and not overly formal. This is supposed to be heart and soul. Right, Val?
Right. I was laughing because I was just in Zoom less than 24 hours with the femur CRT. So we're back.
There we go. You
We're
see
back
all
like we
these
never
critical.
left.
Amazing. Well, I'm excited about today, and we're going to go recorded in about 10 seconds. So I'm going to be a little bit quiet just for a sec. And it is exactly 9 o'clock. So I wish you a very, very, very good morning. I get excited about every Impact Collaborative. My name is Maria, and I'm your, I guess, at your service here at the Women's Fund. And I get excited about every Impact Collaborative, everything that we do. But I'm especially excited about today because I am a lifelong learner, like every single one of you here. I see many of you logged on already. I see you. I know you. You are lifelong learners as well. So my brain is ready to absorb, and I hope yours is too. Welcome to this, your very own Women's Fund Miami-Dade. On we go. Let me thank the people. Some of the people make this possible. Our current and former board members are amazing. That includes our founder, Madam Marilyn Gladstone. You are still our rock. We have many elected officials and direct service providers who are with us, community partners. We don't do anything alone. And sometimes we make that formal. We say #1team, like we're doing on the road of no trafficking to the FIFA game. So we have many, many partners doing a lot of collaborative work. So we thank you. And the most collaborative, of course, as I've said, are these amazing board members right here, right here. Thank you, each and all. There are a lot of things we can't do. There's so many different ways to be a part of your Women's Fund. You can be a volunteer impact partner. You can be in attendance in something like this today and spread the word to your networks. Can also fuel our mission. Many of you do both. You show up, you volunteer, you learn, and you help fuel the mission. Our program of impact partners are the people that we can count on for unrestricted funds all year long. That makes the work really possible, and it makes us agile and creative and able to support the current needs as they come to our friends in Miami-Dade. So thank you very, very much, Impact Partners. And if you didn't know one of the biggest impact ones, it's Citrus Health Network, who are a constant partner in work in so many, many different ways, in direct services, and also working on human trafficking and working with the foster kids. We love Citrus Health and the people who work there. So thanks to them for being our health and well-being pillar sponsor. So before I give Viv her quick cameo moment, Viviana Alvaro Pacheco, you all know, she's almost there, unless you haven't been here before, is our Director of Research and Policy. But Viv grows in many ways. So as you keep on hearing AIM, which stands for Alliance for Infant and Maternal Health Miami-Dade. Just know that Viviana is also leading there with our amazing colleague who you're going to hear from today, Val Butler. We have strong, strong, strong programs and a strong team behind. So Viv will give her cameo now of her little data point, but I want you to know there's a lot more going on behind the scenes with Viviana. So Viv, take it away.
Good morning, everybody. Thanks, Maria. Dana, can you go to the next slide, please? So for every Impact Collaborative, we try to do a small data moment where we highlight our gender equity index. Our gender equity index measures gender equity in Miami-Dade County, and it is off of our 4 pillars. So for today's Impact Collaborative, we're highlighting our health and well-being pillar. And based on the analysis that we did for our health and well-being metrics, which include health insurance, maternal morbidity, infant mortality, disparity, and teenage pregnancy, we see that gender parity has widened over the last decade. The health and well-being score for 2023 was 44 points, which is a decrease from 2010 and unchanged from 2022. This is a project that we started in 2021, and so every single year we updated with the most up-to-date data and based on these metrics that you see here. Now, for the purposes of this Impact Collaborative, I also wanted to share what infant mortality looks like for Miami-Dade County. And what you'll see here is that the infant mortality rate decreased to 4.8 per 1,000 births in 2023, after being at its highest in 2022 at 5.9 per rate per 1,000 births. Now, I also wanted to highlight that Black birthing people had the highest infant mortality rate at 11.3 per 1,000 births in 2023. So that is not something that's on the graph, but I wanted to make sure that we knew it and that we're cognizant that these disparities exist. Thank you so much.
Thank you, Viviana, for this and more. So, team audience, many of you have been speaking here before. Many of you know each other. Many of you work with us day in and day out. You are the life's breath of today. We're conducting 3 polls. We ask you to please, please participate in them. Please talk to each other in that chat, communicate, share resources, say who you are and where you're here. If you said it at a couple minutes to 9 and not everybody was logged on, say it again. Please do participate, and that includes the exit survey. We know I get too many surveys. Ours is really short, and it does help us because we do collect the data, and we want to collect real data and real feedback because, as you know, we're always iterating. So if you say something that you like, we'll give you more of what you like. If you need something more of something or something you don't like, we're going to notice and we're going to listen. So please, thank you, and do participate. And then on we go. I'm going to, I always let our keynote, who's really our framer for each day, introduce themselves, and that's not going to be any different with Dr. Bonilla. But I want you to give a little bit of background of context as AIM, Alliance for Infant and Maternal Health, Miami-Dade, has been forming, has been incubating for over 3, probably 4 years before we realized that we needed to give birth to this AIM, Alliance for Infant Maternal Health Miami-Dade. There were several people who were really instrumental in helping us know that this was truly something that was a gap in need in Miami-Dade. Women's Fund is not in the business of doing something that's not needed, that somebody else is doing brilliantly well. We're in the gaps in needs business. And this was a true gap in need. And so Dr. Bonilla has been an incredible thought partner, thought leader in this. And so we welcome her in a very special way. This Impact Collaborative, we're going to do it slightly differently. She's going to give us the framework. And then instead of just joining us in the Q&A, we're going to ask her to join as a panelist as well, because we've got lots of information we need from her. So Connie, good morning. Good doctor, please.
Good morning.
Welcome everybody.
Good
Take it away.
morning. Thank you for that lovely introduction. And good morning, everyone. I can't even tell you how appreciative I am that you are here today to learn about this important issue. Some of you may come to this table knowing a lot, And some, this may be the first that you've heard about the issue of preterm births and infant mortality, not only nationwide, but what's going on in our local county. So a little bit about me very quickly. I have worked in maternal child health for over 30 years. I've been on the faculty at the University of Miami in the Department of Pediatrics during that time period, but have always been invested, and my work is primarily in the area of maternal child health service programs that are community-based. We are out in the community, we are home visiting, we are working with moms and babies to improve health outcomes. And that is through both Florida Healthy Start, which is funded by the Healthy Start Coalition, and through our Jasmine Project, which is a federal program in the north end of the county focused on reducing disparities in infant mortality, which I'm going to talk a little bit more in my presentation. So without further ado, I'm going to go ahead and get started because there's so many important things we need to discuss today, and I want to make sure that we have time to get to all of them. Okay, so as you know, today we are talking about $1 million babies, right? We don't want babies to cost $1 million. So today, what we're going to really be focused on is what the problem is and how we can solve it. Okay, just a little bit about my disclaimer. Of course, I don't endorse a specific practice, and I'm just presenting based on what we know to be in the current date and time to be best practices. So we really want to focus our energy today. We want to walk away knowing what the problem is, right? And then really having a good understanding of what that problem is costing us and how preventable it is if we work together with community-based solutions. So we are unfortunately in the middle of a maternal child health crisis, okay? And this is not just in Miami-Dade, it's nationwide. We have really high rates of infant mortality and preterm births. So let's kind of take a deeper dive in looking at this overall picture, right? So we know that infant mortality is really defined as the number of infant deaths that occur before age 1, okay? So that's anytime from birth till that first birthday of the baby. And that it really is an indicator of the overall health of your society, right? If your babies are healthy, that means your society is generally healthy. Your moms are healthy, your families are healthy. Unfortunately, in the United States, we have about 20,000 babies that die every year. This goes up a little some years, comes down a little, but it's always right around that number. Now, just to give you context, think about if a jumbo jet plane with 400 people on it crashed every week in the United States. That's how many babies are dying every week. Okay, just take that in for a moment, because we know that if that were happening, all of our resources, all of our energy will be poured into solving that problem, right? So we really want to make people understand, help people understand that this is all of our, this issue belongs to all of us. So how does the United States rank compared to other developed countries? Okay, we are 33rd out of 38 in terms of our infant mortality rate. And if you look here in the chart, you can see the average for the country overall, all the developed nations in the world, and there is an official definition for that. Our infant mortality rate falls well below the mean, and we're really at the bottom of the barrel. Our very best state is Vermont, right? And it falls number 20 compared to a number of other countries. So somehow other countries have kind of figured this out. You know, obviously every country is different in terms of the solutions that they work through. But what's important is for us to understand that we can do better, right? We're the United States of America and we can do better. So what are the drivers of US infant mortality? This is a question I get all the time, right? Okay, so what causes it? Why are we so much higher than other countries? Okay, and I'm going to pull up this little infographic, which I want to acknowledge was created using AI. So this kind of fun when we get to use this new technology to help get our messaging across to you all. So we know that the United States, the infant mortality rate is 5.6, right? But what causes it? Well, we know that the top leading cause is what you would expect, it's birth defects. Now, birth defects, our science is getting better, and we are getting better at prevention in that area, but birth defects is probably the one category that's a little harder to impact. When you look at the remaining categories, with the number 2 driver of infant mortality being preterm and low birth weights, right? This category is very preventable, as is SIDS, sudden infant death, right? And maternal complications, which are health complications that the mother has, and unintentional injuries. All 4 of these drivers of infant mortality we can impact if we focus on them. So there's a lot of work to be done, but the good news is that the stage is set because we know that these things can be impacted. And again, as Viv mentioned, unfortunately, we do have in the United States the disparities that occur where Black babies are dying at a rate of about 2.5 times that of white babies. And then we have other high-risk groups as well, such as American Indians and Native Hawaiians. Okay, here we go. Now I want to drill down a little bit into Miami-Dade and our data locally, right? Here we go, it's gonna pull up. Everybody can see that. Okay, so this is the data from Miami-Dade County. And as you can see, our overall infant mortality rate is lower than the national average and lower than the state of Florida. So overall in Miami-Dade, we're actually doing pretty well. But when you look at the disparity, it's much greater than the national disparity. So Black babies in Miami-Dade County die at a rate more than 3 times greater than white babies. And so we do definitely have a lot of work to do in the county to address our most vulnerable populations with a death rate of 11.6, which really is something that hasn't changed much in the last 10 or 15 years. Some years it's not quite as much, but that gap, I've worked in the field for a long time, and it's still there. And part of the issue is that we're all working in silos, and until we come together and work as a community with common messaging and focusing on evidence-based approaches, we're not going to be able to really, really bring our infant mortality rates down. And really the goal is for Miami-Dade to really lower the infant mortality rate by lowering the rates of the most disadvantaged populations, right? But you can see again, the drivers, preterm birth rate with an overall rate in Miami-Dade of about 10%. But again, you see the disparity with Black women versus white women. It's nearly double. And low birth weight, we see a similar finding, right? So, okay. So what causes preterm birth? Because if we don't know what causes it, then we can't really try to bring down those rates. Well, we know already that preterm births are one of the #1 drivers of infant mortality. And we know how costly preterm births are. We're going to look at that in just a moment. But what causes it, right? Well, there's definitely risk factors. The thing about preterm births is this is really a multi-determined problem, right? So it's not caused by any one thing, but when you are a woman and you walk into a delivery room and you are that person who has that preterm baby, you only care about your risk factors, right? As a community, we know there are certain things that do correlate and seem to be linked to preterm births, like having a prior preterm birth. We know you're already at risk. Being pregnant with twins places you at risk. Having certain conditions, infections, things like that can also increase your risk. And we know that any kind of assisted reproduction also can increase your risk. We know that when we have babies too close together, that increases your risk. Probably the #1 area that is related to increased risk for a preterm birth, though, is the health of mom, right? So maternal health and her medical history. Does she have any chronic health conditions? And particularly if she experiences hypertensive disorders before or during pregnancy, oftentimes that places her at risk for preeclampsia, which is a very dangerous health condition that impacts the mom and the baby. And oftentimes babies have to be induced and born early or be born via C-section because of preeclampsia, right? We know that younger women or older women are more likely to have preterm babies. And we also know that health as measured by your weight, being underweight or overweight, are risk factors, right? But there's also lifestyle factors, socioeconomic factors, right? Kind of the obvious ones, substance use, stress. I really want to mention maternal depression and mental health issues because that is really coming onto the landscape as more and more research is coming out showing us that depression is related to preterm births. So moms that are depressed, their stress systems are activated, and that's probably the mechanism that might trigger a preterm birth, usually in combination with other risk factors. We know that lack of education, lower income, and we also race, ethnicity, as we've already discussed. And another huge one, lack of prenatal care or inadequate prenatal care, access to good medical services. Every woman in the United States who is pregnant deserves to know that she can go to a doctor and get the care she needs to have a healthy baby. And we also know that women who do this really physically demanding work, that they're at greater risk as well. Okay, so what are the costs, right? Unfortunately, we know the dollars don't always save lives. And that we have large societal costs due to preterm births. Now, remember, a little while ago, I told you preterm births were very preventable, okay? Yet we're still paying too much money to care for babies because they are born too early. Okay, so the total societal cost, and this is based on 2016 data, which is really the most current data that we have right now in terms of cost, is 25.2 billion. Okay, we can't even wrap our head, it's not million, it's billion. We can't wrap our head around that number. So there's a lot we can do because so many babies that are born early are on Medicaid. Okay, so there's a lot we can do as a country to try to improve our preterm birth rates and bring those costs down. We know that the average cost of a preterm infant is almost $65,000, but if you look at those babies that are born before 28 weeks, the average cost is over 300,000, upwards to $1 million. Okay, so the important thing to understand about this is just the medical care costs, right? So about 68% of these costs are the medical care for the child, and then of course we have mom's lost productivity because she has to be in the NICU with her baby. And then we also have the costs related to mom's delivery. She oftentimes has had a C-section or an emergency delivery. And then there are also costs, related to education that we have to do to try to help mom know how to take care of her baby, help the family understand the special medical issues that baby might have, right? Okay. So now we're going to take a little bit, drill down a little bit more on some of these costs to really understand what drives the maternal morbidity costs. So these are costs not just related to preterm births, but just related to when mom is unhealthy, right? So when mom is unhealthy, hypertensive disorders, gestational diabetes, things like that, costs go up. And we know that about $32.3 billion is estimated for maternal morbidity and mortality conditions. And like 74% of those costs are related to child outcomes. So we know preterm births, again, a huge driver of those costs. But then there's also the longer term costs of having that preterm baby. So babies who are born preterm have long-term health issues. They have developmental disorders that need intervention. Oftentimes they can have retinopathy of prematurity, which impacts their vision. So there's special costs and surgeries related to that. Heart conditions that require surgery. Respiratory distress syndrome and asthma are huge costs that are associated with being born too early. And then, of course, there's a lot of other health outcomes, right? So we have to factor in the full spectrum of costs. It's not just those medical costs when the child is first born, but the long-term costs and the sequelae that go with it, right? And then just a little bit on the costs related to mom, right? Her share of the costs, and what drives that. And we know that it really is the maternal mental health conditions, hypertensive disorders, and hemorrhage and other severe complications that that account for mom's costs, right? Again, maternal mental health conditions is one of the number one causes of maternal deaths in this country. So we need to understand it's not hypertensive disorders, it's not her, it's maternal mental health. So I really want to get that on everybody's radar so that they understand that this too is a really important issue we need to be focusing on, right? And then you can also see not only the loss of productivity, but C-section costs, hospital stay costs, and other maternal outcomes. Okay. So I don't know about all of you, but I've spent a lot of time over the last 30 years sitting in meetings where we talk about all these problems and we talk about the costs. And then we go home and we go back to our offices and we keep doing our work. And in our little silo and in the way we're working, we try to make a difference. But the problem is we don't move the needle as a community unless we work together as a community. Okay, and that's what the Women's Fund and the work of AIM is all about. But I want to talk first a little bit about some of the collective solutions that we know are evidence-based, that we know do make a difference. Okay, we do know community-wide that infant mortality and preterm birth rates really require, because so many different things cause them, it requires comprehensive evidence-based interventions that are community-driven, because every community is different. So what may really drive an infant mortality rate or a preterm birth rate in a small rural community, which maybe has maternal health deserts, there's no prenatal care available, those indicators might be very different than a large urban county like Miami-Dade, where we have a lot of resources, but it's getting people connected to the resources and getting the messaging all the same, right? Based on the evidence and the things that we know really work. So given that, there are certain evidence-based strategies where we do know they make a difference and can reduce preterm birth rates. And one of the number one things, and this is where a lot of my work has been, and I know Dr. Kumar is going to talk about her work in this area as well, is utilizing community health workers and home visitation programs. The reason for this is that oftentimes these workers come from the community. They can relate to that particular women's health need, right? And they can understand it. And they also know all the services and work really hard to make sure, I know we do, at least in our programs, work really hard to make sure our moms get to their prenatal care appointments, get the health care they need, have breastfeeding support and education so that because we know that if we breastfeed our babies, they're going to be healthier and at lower risk for infant mortality, right? Doing that safe sleep education with them. So that's what these programs can do. In Miami-Dade, we currently have our Federal Healthy Start program, which is the Jasmine Project. We have Florida Healthy Start, which is countywide, okay, and is really focused on reducing infant mortality as well. And we have a number of other home visitation programs that also focus on these things like healthy families and nurse family partnerships. So we have a lot of support in the community at the level of the home visitation, which is really great. But we need to partner with our clinical providers, right, to make sure everybody is talking together and working together. Okay. So some other things that we know work is access to things like group prenatal care and doulas and midwives. And there's been a big push really in the last 5 years, I would say, to expand the doula workforce as we recognize the importance of women having the support of that person with them, not only at birth, but providing education beforehand to reduce their risk, right? And then we know that there's a number of things that we can do as a community. We can support healthy behaviors by really focusing on educating women throughout the lifespan, in high school, before they have babies, before, during, and after pregnancy. It's the health of the health, your health is so important. So really educating women on the importance of nutrition and exercise and just the importance of overall health. And then access to medical care is critical, right? By improving access, we can reduce risk significantly, particularly when managing some of these chronic health conditions that can really elevate your risk for having a preterm baby. And then we want to really community-wise, not just educate our moms or our potential moms, but we really need to raise awareness and advocacy in the entire community. Again, and that's what we're going to try to do with AIM, right? We know that public campaigns like the March of Dimes, Healthy Babies Are Worth the Wait, was really successful in reducing non-medically necessary C-sections, for example, which drive up the preterm birth rate. We know that safe sleep campaigns have been incredibly effective in reducing infant deaths. So these are all things that, but it's not just by educating moms, it's by educating the entire community so that everybody knows and supports healthier behaviors, right? And then really strengthening coordination of service providers, that one-stop shop where mom can get her mental health needs taken care of at the same time that she gets her physical health needs. She can get referrals kind of all together. These things have all been shown to help drive down the preterm birth rate, right? And then really important, we have to target our at-risk conditions. So chronic disease management is critical. I've talked a little bit about mental health, but we're lucky and we're fortunate in Miami-Dade that through the efforts of the Healthy Start Coalition and Healthy Start and through the Children's Trust, many of the programs that we're implementing now, moms are being screened for depression, right? And through Florida Healthy Start, we're able to offer the Moving Beyond Depression program, which is essentially a home-based or virtual cognitive behavioral therapy intervention that works very closely with that home visiting team to collaborate and integrate and make sure that that mom's service needs are being met across her full spectrum. So unfortunately, the capacity of these programs is limited, right? So we can't serve everybody that has a need. So, and as you know, maternal mental health is such a big driver of preterm births as well, that we really need to make sure that every mother during pregnancy or the postpartum period who's experiencing depression can have access to evidence-based treatment, because we know that we can get excellent treatment outcome results when treatment is designed to work closely with the mom's needs. And then healthy baby spacing, that's just been known for many years, and it's really part of any any home visitations program. And most women should hear this at our doctor's office, but it's a message that we need to get out to everybody, right? 18 months between your pregnancies. And then finally, addressing some of the social factors that influence health. We know that these are the big system issues that really underlie and drive a lot of this, drive a lot of our infant mortality and preterm birth rates. So if we can strengthen our social and community contacts, then we can have healthier babies and healthier moms. Unfortunately, these are the things I've already spoken about. I don't want to say they're easy, but they're more doable, right? It's easy to develop a public health, campaign on a specific issue. These things really require huge policy shifts, huge buy-in at many levels, and everybody steering the boat in the same direction. But we cannot, just because it's hard, doesn't mean we don't do the work, right? We have to always keep these things on the table, being aware of them, and doing what we can to start to work on impacting policies that can change them. So I know we've had another impact collaborative on addressing heat and climate impacts on pregnant women, and I really encourage you all to watch that. It's really an issue that we're learning more and more about all the time. We know that food and housing security is critical, and that we have a crisis in Miami-Dade in relationship to particularly housing security. So that is an area that we should really be looking at. And then anything to promote financial stability, right? And these are high-level programs that work at the level of policy, work at the level of government, strengthening father involvement. All of these things can decrease the financial stress. We know that in 2021, when we had the child tax credit implemented, that and some of those stimulus checks went out, we lifted so many children out of poverty during that time period and improved outcomes. So these are all things that we have to keep our eye on: many balls, the short-term balls, things that we can impact quickly, the long-term balls, where we're all rowing upstream together, right? So we know that implementing all of these approaches is really the best path for communities to meaningfully lower their infant mortality and preterm birth rates, right? And we have to work together. And that is really what AIM is designed to do, the Alliance for Infant and Maternal Health that the Women's Fund has been working so diligently on. I'm so excited to be a part of it. I think Miami-Dade is going to do incredible things, and that we are going to set the stage for other communities nationally to follow. Okay. And through AIM, it's really about bringing families and communities, stakeholders together, because we have to listen to our families. They tell us what the issues are, right? And gather those community data and needs, right? And then once we determine what is most important in our community, because I, of course, talked a lot about different things, but every community is different, then that is where we have our call to action, right? We're going to plan, we are going to create evidence-based initiatives, and we are going to have an impact. And that is what it's all about, right? Is creating an impact that meaningfully moves the needle on infant mortality and preterm births in our county. So I invite all of you to join us in this work. It's so important, and every agency can do something, right? So,
Sure. So many of them are here, Connie. So many of them are here today.
yay!
So many of them are
so
here
excited
today.
about that.
We have a huge
So this is
sphere
my
of.
call to action and my challenge, our challenge, right? So I'm going to let you take over from here, Mara. Okay.
And we're going to invite you back in in a minute. So incredible spheres of influence here, and I'm just gonna, humor makes it stick. This is pregnant with meaning. This is true. We're so intentional about AIM, Alliance for Infant and Maternal Health. Miami-Dade is on there for now. We are working in this very important subset of the country and of the world, Miami-Dade County. Everything that we learn here will be able to be replicable, and we are going to be saving lives because you're all going to be a part of it. The Children's Movement, Health Foundation, the Children's Trust, Healthy Start. So many amazing people are here with us today, and stronger together, which is our motto, has never been more important. So we are going to welcome another amazing leader to do the impossible. Introduce yourself in 2 minutes or less, Dr. Kumar.
Yes, thank you so much. I am totally mesmerized by the presentation earlier on, so I'm still seeping in all of that. But thank you so much for introducing me. My name is Dr. Smita Kumar, and I am the program director for the Florida Community Health Workers Coalition. I'm truly honored to be joining in as a panelist over here in this big, great initiative and with the Miami-Dade Foundation. So I have seen that, and we have just seen everything that has gone on, and I want to focus on saying that community health workers are playing a very important part in improving the health of maternal and infant health in Miami-Dade area, and we're looking forward to this collaboration and contributing in a positive way with them. So I'll just go ahead and talk a little bit more. Next slide, please. Next slide, please.
1 second.
Yes, so everything was so beautifully presented about all of the great data that have been in the last presentation. So I will jump right up and talk about what is the CHWs are doing. So CHW workers, we are the four frontline professionals, and we are trying to approach this very important subject in a very culturally appropriate way, providing education, support, connecting, and caring for the society that we work in. So when we are bridging the health systems and the families, we're trying to break down the barriers that are present, that keeps the mothers not from the life-saving perinatal and postpartum services. So we try to connect them. So just a few quick data I'd like to talk about out here is about how providing CHW interventions and how it reflects in the Miami-Dade area. So when a CHW is working with a mother or with an expectant mother, it has been seen that there has been a 25 to 40% reduction in the preterm birth rates. And this is similar in the Miami-Dade area also. So the CHW workers, they visit them, they take care of their social needs, which is keeping them from getting the care that they require to have a healthy pregnancy and in turn a healthy baby after. Also, following delivery or having the baby, we follow up on what are the social requirements as it changes once they deliver the baby. So following up on all of this, number one, it reduces preterm births by 40% before or during the pregnancy when we intervene. And once this care continues on, we reduce the amount of infant mortality also. So as you can see, not only are we reducing the admissions into the hospital for the baby after birth or the NICU admissions by 25%, we are also making sure that the client continues on the care after they give birth, so up till 1 year and beyond. So we try to see we identify what are their social supports that they need, what is the education that they need, what is the problem that is keeping them from having a healthy baby. So early intervention is what we plan to do and what we do, and that's where we provide the comprehensive support to our to the mothers and to the babies. So all of this gets better outcome for the mother and the baby. So as you've seen, all of the wonderful data that has been provided in the previous presentations, I would like to also add on to that having social barriers is identifying the social barriers is also so very important. In the Miami-Dade area, nearly 1 in every 5 women of the childbearing age lives below the poverty line. And so this would also mean that they have unsuitable housing or limited childcare. So they basically have to make tough choices between work and prenatal appointments. Now, as we see over here that housing insecurities and all of these things also increases the risk of preterm of low weight babies by 40%. So looking at all of this, we try to come together and get all the resources for the baby, for the mother and the baby at the later stage. So we are bridging the gap. We are providing all of this in a culturally appropriate setting. So many people would like culturally appropriate approaches to them when we approach them. So we are able to talk their talk, as they say, because many of our CHWs are from the community that they are serving, and many of them have gone through the same issues that these mothers are facing. So all of this combined together, we are able to provide the mothers, the expectant mothers, and the new mothers, the resources and the support that they need, be it social support and be it mental support, or bridging or connecting them to healthcare professionals when they are required. I'll just give a quick example about a CHW. one of our CHWs in the Miami area. So when they approached our client, who was a first-time mother, the first-time mother was overwhelmed, didn't have resources, she missed critical appointments. So we were able to bridge them, remove the barriers of transportation and additional childcare, connected her to agencies. And because of all of this, Marisol was able to get to the appointments that was required, leading on to a healthy baby that was delivered at full term. So you see that all of these small things add up to a big result that is a healthy baby. And this in turn, as it was pointed out, saves up $1 million. So that's where that's a beautiful term that has been coined, the $1 million baby. So we have saved $1 million baby, and have brought a beautiful being into the world and have continued on to upkeep on her since the last 1 year. So this was a client in Miami-Dade.
Amazing.
Yeah.
Thank you, Dr. Kumar. That's amazing. Amazing. Val, since this is so rich, I'm going to ask you to combine two, also like Dr. Kumar did. If you can introduce yourself and go ahead and just tell us what you're seeing. I have to also preface Val's self-introduction with my personal and professional honor to have somebody like Val as a human being and as a leader, taking over our full dedication as her full-time job within the Women's Fund, dedicated to AIM, Alliance for Infant and Maternal Health, Miami-Dade. That's how seriously we take this project, and we cannot have anybody more serious nor more delightful than Val Butler. So, Val, welcome.
Thank you so much, Maria. And I'm definitely proud to be in good company with Dr. Kumar and Dr. Bonilla, also two who have inspired me, encouraged me, and worked with me along this way, along with so many of our Alliance for Infant and Maternal Health partners joining us today, from Southern Birth Justice to Green Cars for Kids and our March of Dimes friends, everyone in the chat. Thank you all so much for joining in today. It's great to see you outside of operational definitions for a moment. So thank you for joining in. So once again, my name is Val Butler. I am the manager for the Alliance for Infant and Maternal Health with the Women's Fund Miami-Dade. And my background, just to tell you a bit about me, I am not a medical professional. Huge disclaimer right here. But in the Women's Fund team, we are professional conveners and liaisons. And in AIM, it gives me this spectacular opportunity to bring together all of these stakeholders and representatives from a full scope of care when we look at maternal and infant health. And when these alliance members are together, we're able to share best practices. We're able to plan and strategize how we are going to bring to the table data-driven solutions. So it's been a pleasure so far collaborating and experiencing the collaboration, because although we have a lot of silos to break down, we have so many similarities and so many shared mission-driven causes that we're working towards. So when we look at the problem, I think being present today in this Impact Collaborative and just hearing the presentations, one word that really stands out to me is preventability, which not just shows us that we are suffering a loss in this crisis that's beyond what is imaginable, but could have also been prevented. And when we look at Miami-Dade, we're examining a crisis within a crisis, even more so when we look at the disparities that Black mothers and Black infants are suffering as well. So when we look at this problem, we know specifically in Miami-Dade County, Black mothers face nearly 5 times the risk of maternal death from childbirth-related causes as their counterparts. And when we examine this, we don't examine it just in a case of racial ethnic disparities, but in a case of equity and access, because we believe that every birthing person deserves access. It's our human right. It's what we're here for. You know, we're here to thrive. We're here to do well. And we should be able to do so as birthing people, as mothers, as parents as well. And I think one thing is that when we see all of this data, we don't see the reality of it sometimes. And for me in this role, one thing that has really been impactful, and I think an opportunity for me that I truly don't take for granted, is the opportunity to combine my expertise in public affairs and advocacy along with my lived in experience, because I too am a Black mother. And honestly, when I think back on this, I bring these narratives and these memories with me to every meeting, every time we show up with a partner. And I see the data and I also see the reality of it. I see a time when I was there, getting ready for my postpartum visit, my first follow up, and everything was fine. I see a time when, despite socioeconomic comfortability or perhaps no barriers with food insecurity or housing insecurity, I was presented with a dilemma that my life was in crisis as well, despite my education level, despite my experience and ability to self advocate, and despite the healthcare providers that were advocating for me as well. I was too at risk. I think back as well to a time when I was reading and learning as I was preparing and contemplating, conception and what my family will look like, remembering coming to the realization that before I would even become pregnant, I was already high risk as a mother. Just given my ethnicity, given my background, my genetic history as well. And these are the things that we do not talk enough about. So I think when we look at AIM and when we look at this alliance, literally this true convening of partners from a full scope of care, whether that is providers who are creating a support system in a hospital bed or in a mobile midwife clinic, we need to have this unity, this pathway where we're all acknowledging, yes, we have shared best practices, but are we all focusing on them in the same way? Are we all channeling priorities in the same way? And are we all hearing our patients in the same way, hearing our community members in the same way? So I think carrying my experience with me has really guided me in this experience, and being able to share that. I know there are so many people who have these experiences that don't get to share enough. So I thank so many of our partners who do take the time to uplift these stories, and use not just the data to bring solutions, but to also bring the storytelling, the narratives, and the real life experiences to the solutions as well. So I think I don't want to expand too much on
That's perfect.
time.
Well, if you
Yeah.
like, that's amazing. Val, let's go to each. Smitha, then Val, then Connie. In 2 minutes or less, your calls to action and what can we do? You've got an engaged, heavy network here. Tell us what to do. Smitha, go ahead. You're on mute, my friend.
So sorry. That happens. Technology. Sorry about that. Yes, calls for action. Number one, I really think that community health workers are great sources. You need to be connected, so partner up with them. Also, we are pushing for community health workers to be trained as doulas. That is, we are providing them as a career upgrade as they go down the lane, because it has been seen that community health workers who have the resources and who work as doulas or midwives through the different initiatives like the March of Dimes doula expansion initiative that is there. So we have seen that the community is able to better be connected and be served in that way. So every dollar that is invested with the community health workers maternal programs, you have an return back of 2.50 to $3, and that goes towards avoiding NICU and emergency care services. So I see that we are investing in our future, and we are investing in a healthier baby as they come.
Brilliant. Val, calls to action.
So I think when I am considering calls to action to share, I definitely reflect on the 4 action areas that we focus on within AIM. And I think, firstly, when we're convening, when we're bringing together stakeholders, if there's an organization or a doula, a midwife, an on the ground grassroots organization that you see putting in the work to advocate for birthing people or to advocate for health access, let us know, connect us. We're growing the alliance day by day. Right now, we're at 40 plus members. And that's, as I said earlier, representing a full spectrum of care in various settings, from at home to community-based settings, hospital settings, clinics, and everything in between. So let us know. We are very open. I do my best to get through every single email as much as I can. And then also, I think of our second action area right now, our data analytics dashboard. So as we are in this stage, we're also being very mindful as we lay the framework for this. So I think if you are able to reflect on this with us, I encourage you to advocate for others. I encourage you to, as you learn, share, which for me has been such a huge learning experience as we go day by day. I'm sure for many of us in the Women's Fund Miami-Dade team. And I think that also showcases itself, I'll skip 3, to our fourth action area, deploying public awareness campaigns. Whereas the Women's Fund Miami-Dade is known for getting the message out there. But as our community partners, as residents in Miami-Dade County, as sisters, brothers, daughters, nieces, nephews, I encourage you to be the one at your household, at the coffee shop, at girls' night out. Be the one to create space and hold space for birthing people to share, because we know, even with data, that having that web of support, being able to voice those things, being able to have that cathartic opportunity is so useful. Even as Dr. Bonilla was sharing on maternal mental health, so much of that burden is carried alone. So I think advocating and supporting each other would be my main call to action. And I think, of course, I'll hop back a little bit out of order to our number 3 action area, which is our grant making solutions, where I hope you all know that when you are contributing to these organizations, when you are contributing to the Women's Fund Miami-Dade, the Women's Fund Miami-Dade is literally funding for women. It doesn't translate any more direct than that. And I think as we process these grants, we want to make sure that we are capacity building for these organizations, that we're not just having these partnerships that we have great data-driven solutions, but that we're contributing back to ensure that the work is continuing to be done, no matter the climate, the circumstances, the changes of our community, that this work can continue, because we know it's important, we recognize it, we value it, and we want it to continue. Thank you so much.
Thank you, Val. Thanks so much. Connie, can you join us? Give us some calls to action, please. Couple minutes.
Wow. So this is first, I want to thank both Val and Dr. Kumar for just the great comments, and just having boots on the ground, in the work that you do. It's so important. So call to action. I really want you to think about what you heard today and stay focused. I want you to stay focused in your agency work, in your work that you do in any way in the community, and think about these words: prevention and access lead to impact, right? So our efforts need to focus on doing what we know works to prevent preterm births and infant mortality, and increasing access, because we know that access, whether it's access to prenatal care, access to health education, access to equitable birthing experiences, all of these things make a difference. So whatever area your agency works in, I want you to hang your hat on those pillars, and don't just show up to a meeting and have your comments and participate and then go back to your office and do your own work. Join in the effort, because it's going to take all of us working upstream to really, really move the needle on this issue. And that means doing what you can as an agency. So, for some agencies, you might not have dollars to contribute, but you can contribute time, you can contribute workforce efforts. So whatever you can do to impact the issue. And then I want to say, if you are in any way a service provider or a funder, and you can impact the capacity that we have in Miami-Dade County for providing maternal mental health services that are both evidence-based and that also really address the experience of the birthing person during pregnancy and the postpartum period. Because, you know, the key is your experience is different when you're a new mother or a new parent or you're pregnant. And sometimes depression is different in that regard. So expanding capacity in that area, because we know it, you know, it's such an important area. But in all the areas talked about today, it's important, right? And we know that there are these things that we can do to prevent. And prevention saves millions of dollars and even billions of dollars. So if we could just get smart about this and put our investments in the right place, right? Then we can save a lot of money down the road for our community, for our healthcare systems, and really, really save lives at the same time. Because every baby deserves the right to reach their first birthday and be healthy, right? And participate
And that's
in a
priceless.
productive way to our society, right?
And that is priceless. So the $1 million can very much be real. We can spend that as a society on a baby. If we need to, we should. But let's save quality of life. It's not only maternal mortality, it's also maternal morbidity. Let's have healthy, productive, happy moms, right? Let's have healthy, happy babies. Let's have smart economies and smart collaborative work together. Join us, get energized. We're always in for the long haul. This is great. This is not short term. This is long term. And these are things that we can do so much better. We know the stats. Now these people get to gather together, support them in every single way you can, be a part. Come together with us. We meet every month at Your Women's from Miami-Dade for an amazing impact collaborative, and they take many, many, many turns, but all of them tell you what you need to know and what you can do to support women and girls in Miami-Dade County. We are here at your side and at your service. And I always have to say, you know, good fun for a good cause. I've been known to have a martini or two and to laugh out loud. And we're gathering next Thursday at our annual event, Raise the Bar. I think we have close to 20 judiciary who are going to be there, lots of attorneys, many survivor leaders, community partners, people who are champions who've come out on the other side of freedom from violence, which is our special focus here. But the Raise the Bar supports everything we do. We also tend to have a really good silent auction, and there are a lot of really good things. Outbid me. Go ahead, go on our website, sign up, put in your credit card now, start bidding, and know that there's still even more things that are going to be added. And still join us. So Maria Teresa and Samantha are at your service. All of us are at your service. Come join us for Raise the Bar. Come volunteer with us, and we'll see you this time next month. Thank you so much for being a part. You are your Women's Fund Miami-Dade. Connie.